Yes, students, today's topic is dentigerous cyst. Dentigerous cyst is the cavity or cyst which is originating from odontogenic apparatus or the tooth-forming cells, and they are the most commonest developmental odontogenic cyst. The cystic is a pathological cavity which is having fluid, semi-fluid, or gaseous contents and which is not created by the accumulation of pus. Most cysts, but not all, are lined by epithelium. The definition of one by Kramer in 1974. The dentigerous cyst is a cyst which is originated by the separation of follicle from the unerupted crown of a tooth. The dentigerous cyst encloses the crown of an unerupted tooth and it is attached to the cemento-enamel junction. Pathogenesis of the cyst is uncertain. Some theories saying that there is an accumulation of fluid in the reduced enamel epithelium as well as the crown. Here is a gross specimen of dentigerous cyst enclosed, showing the cyst is enclosed the crown of the teeth and it is attached to the cervical line. The pathogenesis of dentigerous cyst forms. First one is intrafollicular and the next one is extrafollicular. Intrafollicular, the theory is saying that there is an accumulation of reduced enamel epithelium as well as the enamel, and there is degeneration of the stellate reticulum. It undergoes formation. And next is the extrafollicular one. Here, envelopmental or follicular paralysis of. There is a picture which is showing the unerupted crown. This is the enamel portion and this is the reduced enamel. There is a separation or there is separation of stellate reticulum and forming a cyst over them. This is the histopathological picture showing. This is the epithelial lining and this is the connective tissue fibrous wall. How the separation between reduced enamel epithelium and the enamel takes place. The pressure exerted by the erupting tooth on impacted follicle, then there will be obstruction. Then rapid translation of serum across the capillary walls, then there will be increased hydrostatic pressure and the separation of reduced enamel epithelium from the crown of this. That separation or cavity, there is formation of cyst. The contents or fluid contains mainly glycosaminoglycans, hyaluronic acid, heparin, and chondroitin sulfate. Are the components of the dental follicle. Increases the osmolality of the cyst. Play a role in the expansion of the cyst. If there is an increase in osmolality, there is expansion of cyst also there. Coming to the clinical features, most commonly seen in younger age group, that is first to third decade of life, and most commonly seen in male than in female. And the site of occurrence, the common site for the development of dentigerous cyst, mandibular third molar region. Then, which is showing dentigerous cyst in maxillary canine, mandibular premolar, and maxillary third molar also. Supernumerary teeth also can be dentigerous cyst formation. Signs and symptoms of dentigerous cyst, mainly they are seen accidentally while observing the X. And large lesions can cause cortical expansion. There will be facial displacement, root resorption, pain, if. Frequently, there is no signs and symptoms, not much pronounced signs and symptoms, but large lesions showing like cortical expansion leading to facial displacement, etc. But this is commonly seen accidentally during radiographic examinations. The radiological features, mainly they are showing a unilocular, well-defined lucency with erotic margin, which is associated with the crown of impacted on unerupted. Large DC may show persistence of bony trabeculae and there will be showing multilocularity appearance. The radiological features mainly of types, central type, lateral type, and cerebral type. Central type, the crown of an unerupted tooth is attached to the neck of the tooth, and the lateral type there is a lateral attachment, and the circumferential which is almost cover the whole tooth will be covered. This is the radiographic examples. Here you can see radiolucency at the back of the tooth and this is covering the unerupted crown. And this is the lateral variety. And this is the circumferential variety. This is the radiographic picture of a central type of dentigerous. Here the resorption of root of the first mandibular molar occurs. This is the lateral variety and this is the circumferential. And here it is a scan of maxillary dentigerous come to the nasal floor. Here is the radiolucency which is at the neck. Dentigerous is first dilated follicle. There is a confusion in between whether it is a dentigerous or dilated follicle. If pericoronal radiolucency is greater than 4 mm, we will consider it as a cyst. And the radicular cyst in the serious teeth may mimic dentigerous cyst. So we will have a confusion on that also. The histological features of dentigerous cyst. There is two types of dentigerous cyst, non-inflamed type as well as type. In non-inflamed type, lining is consist of reduced dental epithelium or reduced enamel epithelium-like cells which consist of around the layer thickness of non-characterizable epithelium, and there is no recurrences. Whole composed of fibrous tissue bearing as it is derived from dental papillae. Here is the picture which is showing the components of cyst. All and this is here you can see is empty and this lining is resembling the reduced enamel epithelium and almost the layer thickness, the dense fibrous dental like connective tissues. Here you can see the odontogeny. This is the enlarged view of that hyperchromatic same as that of your reduced enamel epithelium. Next is the inflamed type. Here lining shows varying degree of hyperplasia with regular ridges and occasionally even keratinization. All composed of mature connective tissue by chronic inflammatory cells. Focal areas of mucous can be seen in lining. Small odontogenic epithelial islands also. The inflamed type, you can see there is of the epithelial lining. And there is dense inflammatory also. The differential diagnosis, we have doubt whether it is dentigerous cyst or unicystic ameloblastoma since they are showing the same radiolucency. So have semblance with the adenomatous odontogeny. We will be having confusion about adenomatous odontogeny or the dentigerous cyst. We will go for histopathological evaluation for diagnosis. Complications associated with dentigerous mainly due to incomplete surgical removal. There is a chance of it. And development of ameloblastoma from the lining epithelium and squamous cell carcinoma also arising from the lining epithelium. And also the mucous cells may be the reason for mucous carcinoma. The complications. The treatment option for dentigerous is surgical enucleation and the marsupialization. All single nuclear lesions can be surgically enucleated, for the lesion can be created. And for bigger lesion, can go for marsupialization. The treatment option. Thank you.